Hi guys, this is Dr. Leslie Blevins with Enilda Clinic at enildaclinic.com. Today's learning video, we're going to discuss grief in young children. This is an unfortunate topic, and during the pandemic for COVID-19, unfortunately, it is a topic that I felt like was needed. And so I'm just going to do a brief overview. The first thing that I want to say is that if you have had a loss in your family and you're seeking out this information just to support a young child in your family, one, I'm so sorry, and our thoughts and prayers, everybody here in the U.S. is with you guys, and I know that I'm thinking about everybody, especially with young children, whenever they've had a loss like that. I think that the second thing is that you should always reach out to your child's pediatrician and seek advice about who in your community might be a nice resource. Sometimes there are groups or therapists who specialize in supporting children through the grief process and supporting caregivers and parents who have children going through the grief process. And even if it's not necessarily that you're having an abnormal reaction to grief, but just that you want to make sure that you're doing everything you can to be preventive and to be healthful, then it's worth having an appointment or two just so that you feel good that you're doing everything that you can. And so reaching out to your pediatrician is a good place to start. So let's go into it. I want to talk about the signs that you might see from a young child that they're going into grief. So first off, what I want to say is that whenever I was reviewing the literature for this video, the literature tends to focus on significant others who are lost through death whenever they're talking about grief in young children. And so if you're watching this video and there's a loss in the family or of a friend or somebody who might not be a very significant person, a very close contact to the young child, then they might have different grief reactions than what I'm going to discuss today. And I couldn't find, and I wouldn't be able to really speak about all grief reactions. And so again, if you're seeing different things from your child, then always seek out professional support in that instance. So what I'm speaking about particularly is the research that talks about the loss of a parent or a sibling. Okay, so let's get started. So one of the things to really recognize is that young children oftentimes don't have a framework for what death is or the language to really fully express their feelings or process what is happening in their life. And so we'll sometimes see this with young children who bring up the death in a very nonchalant way. They talk about the deceased person very matter-of-factly, whether they got into a car wreck or they died from COVID-19 or whatever it might be. And it can be a very blunt experience for the adults and older children around the young child, and it can feel like it's an unempathetic type of discussion that the young child is engaging in. The reason for this is that the young child doesn't know how to really understand and emotionally feel about the experience. So oftentimes they're bringing up the experience with other people, with strangers even, with their teachers, with extended family members, in order to see how people respond. And they are getting that emotional experience that these other people have and using that to interpret how they should be experiencing this experience. And they may do it repetitively in order to understand that the experience of that event is consistent, that nothing's changed, that they still understand the situation, the information about the situation hasn't changed at all. So I think that might be one of the more jarring symptoms of grief, is that a child can seem to almost have a distinctly different emotional reaction than what it looks like for older children and for adults who are going through grief where many times for them, they appear to be in grief. Their emotions reflect what they're saying. The second thing is that oftentimes children can play and have played with themes of what happened with the deceased person with dying. And again, this is a way for the child to develop an understanding, to solidify the memory, to understand the details, whatever they might know about the deceased person, even to just relive memories of the deceased person. So when they went to their house and they jumped in their pool and things like that. The other big thing to realize is that with young children, their understanding of what happened with the person who died and that death is very basic at their developmental level. But as they are growing up, they will continually come back to that death experience at new developmental levels. And so it's important to recognize that they will probably come back to you and ask new, deeper questions every time they come back to that experience. And for this reason, young children, or children really of any age, whenever they are grieving, tend to grieve for longer durations. They tend to grieve across their childhood in repetitive fashion. So whereas adults can grieve consistently for well over a year, with children they might grieve for a much shorter period of time and then appear that they're not in grief, and then a year later appear that they're in grief, and several years later appear that they're in grief. And that's normal, that's developmentally appropriate, because with each new developmental level, they have the capacity to understand that grief in a new way. And so new questions come up, new understandings happen for them. Some of the other signs and symptoms that you might see would be some regressions and developmental milestones. So a child who is toilet trained, for instance, or who has met some language milestones might regress for a while. You might see some clinginess with young children, wanting to know where their caregivers are, checking in more, some anxiety in that regard. One of the ways that you can support young children is to have an adult who is emotionally available. Just be there for them, be there to listen, be there to reflect the child's feelings for them. This is a great way to help that child to understand that their feelings of grief are valid, appropriate, and helping the child to really work through their feelings. Oftentimes, not oftentimes, but sometimes, if there's a loss for a young child, that means that that loss is also present for the caregivers as well. And so if the caregiver in your situation is so distraught that they're not able to be emotionally present for the child and able to be that kind of interactive presence for the child, then it's also important that you bring in other caring adults who the young child is familiar with, so that those caring adults can be there to really help the child to learn how to cope and be that model and that mirror for that child, so that the child is continuing to cope with their grief feelings. Okay, so these are just a few of the symptoms of grief in young children. I hope that this was helpful. Remember to reach out to your child's pediatrician if you feel like you need some additional support. You can also always reach out to a child therapist or a child psychologist to get additional support if needed. You don't have to feel like your child is experiencing a disorder or that you're experiencing a mental health disorder in order to get support. Sometimes it's helpful just to have a one-time chat, just to make sure that everything's on the up and up, and to get specific strategies for your situation, so that you know that you can feel confident and comfortable in moving forward and supporting your child during the grieving process. All right, guys, I will see you next time. This is Dr. Blevins with Enilda Clinic at enildaclinic.com.